All right, so really good job on your quiz. Does anybody have any questions? No, everybody's good.
I do have a question, but it's not about the quiz. Do you know when you'll be able to grade our paper?
Yes, I'm working on that. They will be done by this weekend. All right. Janika, are you there? Julianne, I can't see you. There you are. A little bit more. There you go. All I see is your little forehead. All right. So we today are, let's look real quick. So homework grades are going to be turned off. Homework grades will be turned off this week. I'll probably turn them off on Monday, um, or Sunday evening. So next week, you'll have your NCSBN position paper is due, and then your week 8 Saunders questions. And then in week 9, we'll have quiz 5. And then week 10 will be exam 3. And then of course, week 11 is going to be your HESI week. And then week 12 will wrap out. So you guys are doing great. Just keep doing what you're doing. Um, we're almost there. We're in the downhill towards the end. You can see the finish line in sight. Let's see.
Did we have to meet for week 12?
We do. We do have to meet for week 12.
Will it be
Um,
regular class time, Friday at 2:30?
It'll be Friday at 2:30, and then we'll do a check-in. Um, so it won't be the full class, but we do have to do a check-in. Um,
Are you doing the exam review for three for exam
yes,
three?
yep, there'll be an exam review for exam 3 as well as a HESI review. So, let's see what I can do is let me just find it. Um, I just have to find it. I will find it. Um, I'll put it in the announcements. The day and time of it. 'Cause, of course, there's so many announcements. But I'll put the exam review day and time off the top of my head. My calendar. The exam three review will be Sunday, March 8th at, oh my gosh, March already. Can you believe it's going to be March already? Like, that's crazy. Just saying it's crazy. But it'll be Sunday, March 8th at 8 p.m. Eastern. So I will put that in. And then the HESI review. Let me put that on here. It's not. I will do the HESI review on we'll do the 15th at 8.
8 p.m.
We'll put,
review.
yeah, 8 p.m. And I'll put them in the announcements. So actually while we're,
What date
um,
did you say for the hussy?
March 8th.
When oh, you going to review exam three and the hussy on the same day?
No, I'm sorry. Sorry. No, the 8th is the exam 3, the 15th is the HESI review.
Okay.
Sorry, my bad. Yep, because HESI week starts on the 16th of March. I still can't believe I'm saying March. That's crazy. But yeah, I will put those in the announcements so you have them. Um, and you can put them on your calendars or however you guys do it. All right. So This week we have chapter 13, which is nursing theory. And then we have chapter 18, which is what is chapter? I don't know the exact title of the chapter, but it is workplace settings, like finding, your role, where you want to work when you decide that you want to, what area of nursing that you want to work in. So we'll start with chapter 13. Again, chapter 13 is nursing theory. I will share my screen. Let's see, the PowerPoint decides it wants to come up. All right. All right, everybody can see the PowerPoint. We just lost somebody. I don't know who we lost. All right. So again, week 8 is nursing theory. So nursing theory, we look at theories, they are specific to nursing. Some of them we even use for basis for curriculum development. So when we're setting up nursing programs and establishing the curriculum, they also provide a basis for research on the effectiveness of nursing care, right? So a lot of times when we talk about evidence-based practice and things like that, we may refer back to an actual nursing theory. But there are three concepts here that are important to nursing. Obviously, the patient, right? Or the client or the person that the person that is receiving our care. Health, right? We know health is the goal of nursing, right? We're trying to get them back to their previous level of functioning or as close to their previous level of functioning as possible. And then we have the environment. And that is the setting where the nursing care takes place, right? And we know nursing care can take a variety of settings, at home, um, in a facility, in the community, right? So variety. And so nursing theory, especially if you decide that you want to go back and become RNs, you are going to be diving deeper into nursing theory. So like I remember in my bachelor's program, my master's program, we had we had actual specific courses related to nursing theory. So we kind of dove into a bunch of the different theorists. So everybody should know who Florence is, right? Miss Florence Nightingale, um, back in the late 1800s, she was the first to emphasize the environment, right? So ventilation, warmth, noise, light, cleanliness. And we do consider her, the first nursing theorist. She believed that environmental issues influence the course of illness. And she also saw the nursing role as separate from the nurse as just, the doctor's assistant or the person that's going to do the doctor's bidding. Um, she was the first person to collect data and use evidence to make clinical decisions, right? So why do we wash hands, right, in between our clients? And she determined that, an environment that was warm, clean, well lit, that had minimal noise, also resulted in a decreased death rate for soldiers, when she was helping during the war. And so, of course, they tried to adhere to that, to decrease the amount of deaths. Everybody also should know who Abraham Maslow is. He was a psychologist, but we do use his human needs theory um, a lot in nursing. It's also a framework for education. And so his theory states that there are certain internal, external, physical, as well as psychological needs that are common to everybody, right? And the common needs are just arranged in that nice little hierarchy or that big triangle that you guys see. Unmet needs create tension, which motivates the person to react to meet the need, right? So if you think about it, what's at the bottom of that pyramid? Things like oxygenation, right? Nutrition, What else? Elimination, rest, hygiene, right? Um, if you don't have those things, right, you're motivated to get them, right? And so, think about, safety and protection from injury, right? If you're in an unsafe position, that's going to motivate you to become, to go into a safer area. When those needs are met, okay, they're no longer aware of the need, okay, and the need no longer motivates them. So they have safe place to stay, a roof over their heads, right? The motivation isn't to try to get there anymore. So that need has already been met. Um, the dominant needs that matter to the person can vary in life, right? So think about, when you were younger and the needs that you had when you were younger versus now, right? What are the difference? Um, and again, so it varies according to where they are in life. All right. So what are so again with I'm gonna stay on Maslow for a few minutes. So we know that the basic needs, right, are those oxygen, food, water, elimination, sleep, activity, right? Those are your basic needs. Those are the things that we have to meet when they first come into our healthcare environment. And then, of course, the safety needs or security, which is your freedom from harm and protection, right? And so this is why we have those nursing ethics like beneficence and justice. We just want to make sure that our clients are safe, free from falls, free from injury, try to keep them as safe as possible. So there's a couple other ones. So Dorothea Orem. Dorothea Orem, this was the first nursing theory that I was exposed to as a nursing student. And she had her self-care deficit theory. And it has three different sub-theories within it. The first one is self-care. All right. So the self-care is goal that is directed towards a safer environment for life, health, and well-being. And then your self-care deficit is personal care that does not meet therapeutic self-care demands. So what does that mean? Anybody that comes into our care, whether it's in the community, whether it's in a hospital, in a long-term care center, a doctor's office, right? They they have a self-care deficit, right? They're unable to care for themselves. For whatever reason, right? Maybe they're sick, maybe they had a trauma, even somebody that's, having you know, not a detrimental reason for seeking healthcare, right? There is some sort of a self-care deficit. So their personal care doesn't meet their therapeutic self-care demands. And that's what the nursing system is, right? So nurses empower the client through our relationships with them to help them meet their self-care demands, right? So we respond to them, their needs totally, partially, or even in a supportive way in order to get them back to, again, their previous level of functioning or as close to their previous level of functioning as possible. Madeline Leninger. Um, so she had a huge interest in cultural care, and how nursing responds to people of different cultures. And so she developed her cultural care theory. And so when she was developing this theory, she identified two kinds of care in every culture. We have generic, which is, like the home remedies that people use in their care. And we have professional. And professional is, the care that is provided by nurses, doctors, right? Those that are specially trained to provide the care. And there's three modes to guide nursing decisions when we provide care. They are your cultural care preservation or maintenance, your cultural care accommodation or negotiation, and your cultural care repatterning or restructuring. So preservation of or maintenance. And we've talked about cultural care, and I know you've talked about cultural care in other classes, right? And we try to incorporate, right, things that are part of people's cultures into their healthcare, right? As long as it's not, dangerous to themselves or others. So when we look at cultural care, preservation, or maintenance, it's assisting them to maintain their care values that help them to maintain or restore health. Um, and so, what are those? And it's going to vary according to culture, right? There's certain practices that they may follow. When we look at cultural care accommodation or negotiation, um, this is looking at some of the practices that could potentially, what's the word I'm looking for? Not dangerous, but just trying to think of when that would be. Trying to remember what the one in the book says. I think the one in the book was like there's one culture that actually puts the Vicks, the vapor rub inside the nose. All right, which could potentially be aspirated, which can lead to pneumonia, right? And even if you look at the little Vicks thing, it says don't put it in the nose, right? So that could be something that could potentially be dangerous, right? We don't say don't use the Vicks, right? We'll just, show them, I guess a better way to use it, right? By rubbing it on the chest and the neck. Um, your cultural care repatterning, sorry, or restructuring, can't speak today. Um, Again, this is all about just respecting culture, and providing a safe and protective environment. And so, again, it could be different practices that we worry about, that could potentially cause more harm than good. Again, and just teaching them, better ways that they could do it while still practicing their cultural um, value or holding their cultural values. um, Hildegard Peplau, she developed her interpersonal relations theory, and this is how we develop our therapeutic relationships with our clients. And so there's four phases of her theory. um, the first one is orientation. All right, so a person seeks assistance because of a need, right? So it could be that they're sick, they're injured, right? Or, even something else going on. So then, we identified that there is a problem. And then, of course, the nurse is going to work with the client, right, to help them recognize the problem. And then identification is the client understands the situation, and will respond to the nurse who is supplying assistance, right? So you have a client that comes into the clinic, right? And I don't know, maybe they're hypertensive. They weren't feeling, they had a headache, they weren't feeling good. So we've identified the problem, then during the orientation phase, during the identification phase, right, the nurse is working with the client. Maybe we're providing education about stress reduction, diet, exercise, even maybe medications, right? And then exploitation, the client will begin to depend on the nurse, right? And use the help that is offered. And then during the resolution phase, this is where the client now, right, has learned about diet and exercise and medications, right? And that therapeutic relationship is starting to end, and the client maybe is discharged from the hospital at that whatever. So, think about all the different roles that you will fulfill as a nurse, right? not only a caregiver, but you're a teacher, right? A counselor, all of those wonderful things. So again, Hildegard Peplaz is her interpersonal relationship theory, how we build that therapeutic relationship. Rosenstock's health belief theory. So this tries to explain why not a person won't take action to prevent or detect illness. So think about this. What are some reasons why someone does not want to take action to prevent or detect illness?
They don't
So
have health insurance.
okay, they don't have health insurance. Absolutely. That's a huge one, right?
They
What
might be
else?
scared.
They might be scared.
Yeah,
Okay.
scared to know their diagnosis or whatever.
Okay.
The religion, they don't believe in medication.
Their religion, no medication. Okay. What else? Distrust, right? There may be a distrust with healthcare providers, right? So there's a number of reasons. A lot of times perceptions vary. They may not have any basis in reality as well. Um, So, we have to, it could even be embarrassment, maybe some of the symptoms that they're experiencing are embarrassing, right? And they don't want to seek healthcare. Beliefs connected to existing barriers. And so they may see that the preventative or even the treatment activity as expensive, painful, inconvenient. Um, and so I don't know how to think, some of the things, it's not that hard to go, it's a lot easier to go in for like a yearly physical, right? But then when you start like, you get to a certain age, right? And then you have to do your colonoscopies and your mammograms, um, and some of, the prostate exams for guys and some of the other preventative things that are out there could be a little bit, more time consuming, trying to fit it into busy life schedules, right? So it may be, it's a little bit more, inconvenient to them. With a cue to action is seen as necessary. So this is actually one of the things that I have seen and I've noticed, over time, especially within the last year, this has gotten even more. Um, People take notice, and you're watching TV, and you see the commercials for like the colon cancer screening. What is that one? The Cologuard, or there's other ones about hypertension now and heart disease, diabetes, right? And so when we see things on TV that are constantly reminding us, or even if there's one of you get a call from your healthcare provider like, hey, haven't seen you in a while, maybe it's time to schedule a checkup, right? um that may actually spark something within somebody like, oh, maybe I really should make this appointment, go in, get my physical, get my lab work done, right? Do participate in some of those screenings. um but again, the experience is going to be individualized, right? Not everybody is going to respond to that, right? But we can try to reach out to as many people as possible. And so we can use this theory when using our nursing process for health promotion. So, promoting those yearly exams, the vaccinations, even wellness classes. Sister Callista Roy, I was going to try to make this a little bit bigger for y'all, but so she describes the recipient of care or our clients as a holistic adaptive system. So Sister Callista Roy's developed the adaptation model. And within the adaptation model, there are both internal and external stimuli that affect the system. So couple different types of stimuli that are present. Focal stimuli are something direct. So, clients experiencing pain. Contextual stimuli are factors that affect the focal stimuli. So, you have somebody that has, you know, fallen and twisted their ankle, okay? And now the doctor goes in to examine the ankle, um, and right, that's your contextual. And then residual are both internal and external factors. So things like memories of previous pain and that how that affected, the client. She also talks about coping mechanisms. Coping methods are known as both regulator and cognator mechanisms or subsystems. A regulator subsystem, that's the internal effects that take place in response to what's happening internally. And then the cognator subsystem, that's your learning, your processing, your judging, your emotion that they use to cope with what has happened. So think about it when we look at coping mechanisms. If you're in pain, what happens internally? What are some of the internal or physiological symptoms of pain?
People get like agitated
Okay, agitated. What
or
else?
fatigued,
Probably high
maybe.
blood pressure.
Okay, fatigued, high blood pressure, agitated. With acute pain, right? So we'll see that in elevation of blood pressure, pulse, respirations, right? May also see some sweating, depending on how severe the pain is, or maybe some nausea and vomiting involved, right? Um, And then the cognator, right? That's, how do we cope with what has happened, right? So we know that different people and even different cultures deal with pain differently, right? Nobody has the same response to pain. So it is, it really is different. um a little bit more with Sister Roy. There's, she's actually heard if, when you go back for your RN, right, you keep going, you'll learn more about her theory. It's, pretty good. It's very in depth. Let's just put it that way. Then we have Jean Watson, and I don't know if anybody has heard of Jean Watson before. But hers was the theory of human care. And so health is harmony between the body, mind, and spirit, right? That's how we talk, it's why we always talk about providing holistic care for our patients. It involves self-perception and how the self is experienced. Um, and so when we look illness is a lack of harmony within the self and the soul. And so the nursing role is a caring process to help the client regain harmony and health, right? So through us caring for our clients, we're educating our client, right? So they develop self-knowledge, they develop self-healing. And so we're also helping, right, to encourage problem solving, and growth. And it's, generally it's a two-way street, right? The client is growing and learning how to solve problems, as is the nurse, right? Nurses grow through the process as you work with different clients, right? You may identify interventions that work better than others, right? And you'll continue to use those. All right, and I'm going to tell you, there's a lot more theorists out there that you'll come across in your nursing careers. Jean Watson is a really big one. Like I said, Sister Roy, hers was one of the first ones that I learned about, as well as Orum's self-care deficit theory. And again, this is the basis for a lot of different things. And as you go through your education and as you continue to learn, you will learn more about each of these theories. But just having just the basic understanding of, what the theory is good. So why do we do research? Why is research so important?
To figure out new medications and new procedures and stuff.
To
New
see what
procedures,
works.
yeah, new procedures, new medications, right? What interventions work best? Right. So nursing research. And again, remember, Florence Nightingale did her research. So I have an interesting, I don't remember where I heard this or learned this, and I'm sure it was probably when I was in nursing school, forever ago. But nurses or hospitals used to be only open 9 to 5. Did you know that? So hospitals were 9 to 5, right? So nursing staff, doctors, they literally only staff the hospitals from 9 to 5. And all those patients would be left alone at night by themselves. And they couldn't figure out why there was such a high mortality rate, because we're leaving people alone by themselves that are sick and injured, right, and need assistance. And so they saw a significant improvement, right, when they started staffing hospitals 24 hours a day, right? They didn't have as many problems. So research, I'm sure, went into that. Um, but, again, evidence, you've heard the terms evidence-based practice. Um, and how do we get evidence-based practice? By doing research. So it is improved our nursing knowledge. It's generated new knowledge. So other things that nursing research does, before we go, and like I said, it helps identify specific nursing interventions that are proven effective. Um, Evidence that supports quality and cost effectiveness of what nurses do. And then, of course, generating knowledge for clinical practice, nursing education, how we deliver our nursing services. All nurses at all levels, LPN, RN, nurse practitioners, everyone is encouraged to participate and promote nursing research. Um, and so that, if you really like to do research, that may be something that you may like to do, you may want to get involved in, even if it's things like research studies and helping with those. We have two main types of nursing research, or not nursing, just research, sorry. So two types of research studies. We have quantitative and we have qualitative. Quantitative research studies are objective studies. It uses variables. So a variable is the event that we are trying to measure. And we have two types of variables. We have one variable is the group receiving the intervention and the other that's not receiving the intervention. So let's say we have a new medication, okay? And when we look at, how do we know, how do we test the effectiveness of the medication before we market it, right? And we'll have two groups of people. We'll have one group that we are giving the new medication to, and then we'll have the other group that we're giving a placebo to. All right. And so those would be your two variables, the group that is receiving the medication and the group that is not receiving the medication. And what do we do from there, right? We collect data, right? So, we can use a lot of, the side effects, the adverse effects, right? All, are they, having any relief for whatever the medication is being used for, right? What effect is that medication having on the body? And of course, we're still going to measure the other group as well. And so randomized controlled trials, that is the recommended type of quantitative research. And so the person that there's different types. So if I'm running the research study and I split all of y'all into two different groups, I give the medication one group and then the placebo for the other. I may know who is getting what. I may know which of you is getting the placebo and which of you is getting the medication, or in some cases, I may not know. I may not know who's getting which ones. Somebody else has got that information. And so a lot of times too, that'll help to, look and see how effective the medication is. We all know that there is a psychological aspect to medication as well. So we'll just kind of look at compare the two groups as far as symptoms. So again, quantitative is objective using variables. Your qualitative is more of a subjective study. And so instead of, using specific variables and, like medications or treatments or things like this, we gather our data by interviews and direct observation. Um, so it's more of, if we had a group of cancer patients, or we have a group of, I don't know, dementia patients, or, like the slide says, people that are living with chronic pain. Um, and so we literally are going to interview them and observe them. And that is how we collect their data. So this is very subjective, right? Not a whole, I mean, we can make comparisons from one person to another, but it's not as objective. Because everybody's story is different, right? And phenomenology, that is the occurrence or the circumstance that a researcher is studying. It's part of the qualitative, it's a qualitative study. And there's the other things like grounded theories. Trying to think of what else. I don't know much. Most of the research I have done in my past has been quantitative, not qualitative. But an example is on the slide, a case study examining the lived experiences of high school students who were both gifted and diagnosed with ADHD. So that would be more of a qualitative research. So again, quantitative is objective. We're looking at variables. We're collecting, pretty hard data, whereas qualitative is more subjective, right? These are interviews. It's getting their lived experience of whatever the issue is. And then we're taking that information and we're formatting it into a study. So everybody has heard of evidence-based practice. So Dr. Archie Cochrane, he was a British epidemiologist. And so he challenged the public to pay only for medical care that was proven to be effective, and he advocated for the use of randomized control trials as a means of reliably informing healthcare practice. Um, so, think about this. Um, I just read something and I don't remember where I read it. Um, that there was, oh my gosh, it was something where I they were using some sort of a treatment approach that was ineffective, but the provider was telling them that it was research based and it was new. Oh my gosh, what was it? I cannot remember. But think about it. If you go in, you break your arm, or you have hypertension or diabetes, right? Do you want to go and get treatment that you know is going to be effective versus, somebody that says, oh, let's just try this and see if it helps.
You want the treatment that you know is going to be effective.
Right. Like it's like if I said, I don't know, I'm trying to think of something random. Um, so you have high glucose levels and someone says, go chew on a piece of paper, that'll bring your glucose levels down, right? Um, where's the evidence behind that, right? So this is where, he was the first one. He was like, look, go to the doctor. You only pay for care that is proven to be effective, right? And they've used those, that research to prove the effectiveness of these treatments. And so the Cochrane collaboration was established to prepare and promote the accessibility of the Cochrane reviews, which is the evidence-based healthcare interventions, right, that have been developed throughout all of this research. So this to me is probably one of the biggest in 19 I don't know if anybody has heard of this, but in 1999 there was a study done by the Institute of Medicine, and it was trying to it was done to um what is the word I'm looking for? Look at issues within, oh no, one second. To look at issues within healthcare, and what are some of the biggest issues. And so they identified that up to 98,000 people die yearly, by as a result of preventable medical errors. And so it did show that most of the errors resulted from faulty systems, not just, individuals making mistakes. So again, bad complex. A lot of the issues that they identified were preventable. And so it did call for a much safer healthcare system. They identified, some of the things like, doing the timeouts prior to surgery, safety with medication administration, and other things. I don't remember the whole study. But the sad part is, they did a follow-up. Um, and I don't remember if it was 10 years later or 20 years later. But they did a follow-up. I want to say it was 20 years later, and there was a slight improvement, but there was still a significant amount of death and injury as a result of medical awareness or medical, um, like your wrong site surgeries, medication administration, lots of system failures. So again, it's something that we are still working on as a healthcare system. Then in 2001, the Institute of Medicine issued um, the, what is it, Crossing the Quality Chasm, a new healthcare system for 21st century. This one called for consistent, high quality healthcare for all people. It also included um, that clients should receive care based on the best available scientific knowledge. All right. So again, 2001, we know that there was still a significant amount of people that were not covered by health insurance, that may not have been receiving the same quality of care. So this was like quality care for everybody, right? Everybody should receive care based on the available scientific knowledge. Then we had um last couple decades, insurance companies began to pay for healthcare practices only if their effectiveness is supported by scientific evidence. So I have an example for that, for this, and I thought that this was really interesting. So when I first got my bachelor's degree, I started working with an insurance company, which actually was very enlightening. Um, and so most insurance companies, if things aren't evidence-based or even FDA approved, they're not going to approve those, right? So trying to think of something that wouldn't be approved, but I haven't actually, I'll use my example. So when I was working with the or the insurance company, at the time, ankle replacements, ankle implants were not FDA approved. They did not have approval from the FDA to do ankle replacements. Um, and as a result of an injury that I obtained when I was in the military, a few years later, I had to have an ankle replacement. Um, and I was like, okay, so how is this going to work? Even though it's covered through the Veterans Administration, right? If it's not FDA approved, right, is the insurance going to cover it? Well, fortunately, somewhere along the line, it did get FDA approval. However, if there's not scientific evidence to back it up, right, then we don't want to do it. Now, how do we, we talked about how do we get the scientific evidence, right? That's through our research studies, right? So, there are like trials and things that are done that are maybe running at the time. And we see those on the TV all the time, right? Or you hear them on the radio, about current, research studies. Like, it's always, to me, the ones I always hear are about like eczema and allergies and asthma. I mean, there's obviously much more research, um, studies that are out there. Um, but a lot of times you'll hear them like promoting, like, if you're interested or if you have this disease or these symptoms, right? And you may be, you know, willing to participate in their research study. And so they gain their evidence, they get their evidence, and they develop the treatments from that. During the last decade, hospitals are denied payment when complications in a Medicare client develop if evidence-based guidelines are not followed. So what does that mean? So we've there's a huge difference between quantity and quality of care, right? You have a client, you may be in and out of that room 100 times a day, right? For whatever reasons. But if you're not providing the quality of the care, right, that's usually where we get dinged. And so it says hospitals are denied payment when complications in a Medicare client develop if evidence-based guidelines are not followed. So things like your catheter-associated urinary tract infections, your central line infections, um, pressure area or pressure ulcer develops, a fall with a fracture, right? Because maybe we haven't put all of the safety measures in line. We're not turning and repositioning. We're not performing the cath care. Maybe we didn't put the catheter in um, sterilely, right? So that's where that big push for quality of care is. Clients and families are also seeking the latest evidence on websites about the most effective treatment for illnesses and diseases. So it's another big thing that we have information overload in a lot of cases, right? You can go on Google and type in something, and you're going to get a ton of information. And then how do you go through all that information and decide what is the best? Um, and of course, back even when I was younger, as a younger nurse, we didn't have the internet. Right? All the information that we had were through nursing journals, um, your textbooks, right? So huge information highway out there now. And a lot of a lot of people are doing their own research before they even go into the provider's office, to see what is going on. Um, And so again, there's lots of information out there. When we look at how do we identify what the current evidence-based guidelines are, you have access to NCSBN, the NLN, the Institute of Medicine Joint Commission's another one. Joanna Briggs is another one. I always forget there's one. Robert Woods Foundation is a really good resource as well. But there's a variety of different resources out there. If you're going to encourage somebody to do research on their disease process or their medications, send them to a reliable source. Okay, a .edu, a .org. Those are going to be some of your better ways to get information or better places to get information. Try to um, avoid, Dr. Google, right? Um, Although, Google can come up with some really good stuff, but you really want them to gather information from a reliable source. Um, So before we go into this next part, how the best evidence for practice guidelines is determined, let's go ahead and take a break. Be back at 30:55. All right. So, talk about how best evidence for practice guidelines is determined. It is a very rigorous process. All right. So the first step is the clinical question being investigated is formulated in an objective and concise manner. So what is it that we are trying to determine? Um, so I mean, if we wanted to look at, um, why Foley catheters are inserted sterilely versus non-sterile, or, why is trach suctioning a sterile but trach care is non-sterile, right? So whatever the question is, right? So you're going to formulate a question. Then you're going to use professional resources, the latest, most relevant research evidence that pertains to whatever your question is. Okay. So, like I said, why do we put Foley's in? Why do they have to be sterile versus non-sterile? You want to make sure that your sources are credible, and that is always the biggest one. Make sure that you're using credible research resources. Um, so you have like things like the U.S. National Library of Medicine, CINAHL Plus, or CINAHL is another really good one. If you've, I don't know if anybody's ever used the online library, but CINAHL is the Cumulative Index of Nursing and Allied Health Literature. So it is a really good source for you to look at current evidence-based interventions. You have the Cochrane Review, what we talked about earlier, AHRQ, which is your agency for healthcare research and quality. Joanna Briggs is another one. So a variety of resources out there. And of course, you can always still look at like nursing journals and things like that. But like I said, you want to make sure that you have credible sources. So first you're going to formulate your question, then you're going to do your research. And then an expert or panel of experts will conduct a systematic review. So let's say you find, and you're going to find more, but if you're looking at why we do Foley's, sterilely, maybe you found like, 50 articles, okay? So you're going to look at all of those, all of the studies, all 50 studies, and they're just going to review those studies and provide a summary of those results of those studies. Then the guidelines are determined. And those would be the specific practice recommendations as a result of the summary of all the research that you've done. And then using critical thinking skills, the evidence is combined with clinical experience, as well as client preferences and values for use in a specific clinical situation. Again, it really just depends what it is that you're looking at, what you're trying to answer. But that is how we develop our practice guidelines. So first you get your clinical question, you do your research, they'll do a summary of all the findings, determine the guidelines, and then they, using all of that as well as, the experience and client's preferences, and that's how we are going to implement those in our client care. So elements of evidence-based practice in nursing. Okay, so think about this. Everybody has probably heard this before. Why we do the things the way we do, right? Because it's always been done that way, right? That's kind of like the answer that a lot of people have. Why are Foley's put in sterilely? Well, it's because we've always done it that way, right? Even though there's evidence behind it. Is not as sufficient anymore. And if, once even that in your time in nursing school, things have changed, things will continue to change once you graduate. There's going to be new treatments, new technology, new medications, all as a result of right, research that is being done. And so clinical practice needs to be based on scientific knowledge, right, and proof that it is effective. Um, so most facilities use evidence-based practice to develop or even update policy and procedures as well. So always be aware of that. If you come across something in your practice, let's say you start working in a hospital, a nursing home, a clinic, a psych facility, wherever it is that you want to work when you graduate, and there is a procedure that you maybe learned it differently in nursing school or seen it differently in one of your clinical settings, and it's more effective, bring that to the attention of your supervisors, your managers. Um, the more proactive that you are, the better. You want to just make sure, that you've done the research before you present it. So the elements of evidence-based practice, um, there's three different areas. We have our best research evidence, the nurse's clinical experience, and the client preferences, right? We talked about those when we talked about, how we determine those practice guidelines. And we can put them into a nice little what do you call it? A nice little triangle, sorry, with the best practices or the best research evidence, your quality client care, which is your evidence-based practice. Then, of course, your clinical experience and the client's preferences are all part of that, right? So you want to try to make sure that everything that you do, everything that you're working on is evidence-based. So the nurse's role, like I said, is LPNs, even in as you move on with your nursing career, you can become involved with research if you choose to. Um, so with a nurse's role. So nurses with a research doctorate design and implement research studies and publish their findings. All right, so those are like your PhD level nurses. Your nurses with practice doctorate review present research and formulate evidence-based protocols. So those are like your DNPs or your Doctor of Nursing Practice. And there's a variety of different DNP programs out there. Some are clinical based, some are more research based, some are leadership based. It really just depends on what type of program that you want to go into. Nurses at the master's level, they formulate research questions and evaluate the effect of evidence-based solutions on nursing problems. Your bachelor's degree, they can identify questions that need to be studied. They can look and critique published research, use evidence as solutions to nursing problems. Your associate degree or diploma nurses, they can challenge the status quo, question assumptions, offer new insights to improve the quality of care. So like I said, you see something when you start working, they're like, well, we learned it this way in nursing school, or they do it this way at this hospital. Maybe that would be more beneficial. And then, of course, your practical nurses question the basis for nursing actions by considering research evidence, tradition, and client preferences. So again, at every level of nursing, we all have a role in evidence-based practice. And so, like I said, if you see something that you think could be done better, do your research and present it to your leadership. Before I moved to Texas, I had met with some of the um, managers at some of the local hospitals about how the students were doing in clinical and how the new grads are transitioning into the clinical site. And I asked this question, I asked about research, and they highly encourage it. So like if it's something that you're interested in, something that you think could be done a little bit better, that you've seen done better, do your research and present it. Because taking that initiative, right, is something that can just set you apart from your peers. So again, the LPN's role, again, question the basis for nursing actions by considering research evidence, tradition, as well as client practice or client preferences. Question the status quo. You guys are the newer nurses coming in. You have a fresh set of eyes. Review current articles in professional sources as part of your student learning experience. And I don't know how many, like I said, have gone into the online library and looked at some of the resources that are available to you. But it's a huge database. Support nursing interventions on care plans and practice with evidence-based nursing practice, right? So the interventions that we put into place for, infection prevention and, prevention of pressure areas, fall prevention, health restoration, those kinds of things. They're all evidence-based, and you can always look at them. And then as students and grads, you need to follow protocols and procedures for nursing interventions of the agency in which you practice. So everywhere is going to be a little bit different as far as their protocols and how they choose their interventions. So knowing that, knowing your policy and procedures of the organization that you are working with, right, that is going to be key for that. And the spirit of inquiry. So spirit of inquiry, oh my gosh, spirit of inquiry is a nurse that has a spirit of inquiry is one who's going to raise questions, challenge traditional and existing practice, and seek creative approaches to problems. And so I'm going to stop this. And so what that means is, and I'm going to use long-term care as an example. And I know all of you have been in at least, one long-term care facility during your time in nursing school, right? And so obviously they're set up a lot different than a hospital, right? A lot more resources in the hospital for you to have access to. In long-term care, there's, falls is specifically one of the biggest issues that we have, right? Think about a hospital, right? Your hospital beds have alarms. You can use your side rails, right? Different alerts to, hey, this person is trying to get out of bed. Let me go see what's going on, right? We don't have that in long-term care, right? We don't have bed alarms. We don't have side rails, anything like that, to keep a person in bed, right? Because they would be considered restraints. So we often have to be very creative in how we prevent falls from occurring, right? We can use the traditional, call bell within reach, the bed in the lowest position, make sure that they have their water, everything they need within reach. Um, we can put fall mats on the floor, right? But sometimes even that's not enough, right? A lot of, there may be, you may have to get a little bit more creative with some of the interventions that we use to try to prevent falls without violating your client's rights, right? Um, so this is what we're talking about, like doing some research, looking at the articles and seeing, what best practices that are out there that maybe not just the standard practice that everybody uses, and really trying to, think more out of the box when we're looking at some of these things. Because falls, it's someone, an older person falls, breaks a hip or hurts themselves, right? It can be a lot more devastating to them than would be to maybe a younger person with that same injury. All right, so any questions on chapter 13? There's a lot of information in that chapter between the theorists and the different types of research studies. So know your theorists, know the different types of research studies, so quantitative versus qualitative, the steps of that process, right? The clinical expertise, the research, the client preferences, that kind of stuff. So any questions? Like I said, as you go and get your, go through your RN, get your BSN, keep on going, get your nurse practitioners, your doctorates, all that good stuff, you'll get more and more on nursing research as you go through other programs, but having the good foundation is always very helpful. Um, I will tell you, I think it was my bachelor's program. So in my LPN program and in my associate degree program, we didn't have any type of nursing theorist at all, other than Florence Nightingale. And so I can't remember what class it was, but it was one of my bachelor's classes. I had to write a paper on Dorothea Orem, and in the directions for the paper, it was an online course, but it was one of the traditional online courses. So you didn't have any lecture. You just did your discussion questions and your assignments. Um, and so with the directions, this is so embarrassing now that I think about it, but the directions, it was about Orem's theory. It didn't say Dorothea Orem. It wasn't a research class, so it wasn't like I was using nursing theorist book or anything like that. I can't remember what class it was, but we had to write a paper about Orem's theory. I had no idea who Orem was. I was Googling Orem all day long and like nothing was helping. And I wrote this paper. I don't even remember what I wrote. Um, and I remember getting back, the feedback from the instructor was like, I'm not really sure what you were writing here, but basically she was like, you can rewrite this paper, and resubmit for, of course, late deduction and stuff like that. And she provided more of a detailed explanation about the paper. And that's when I learned, like, if you don't know, ask, because it was really embarrassing. I had no idea who Dorothea Orem was. And this was in the early days of the internet, so you didn't have like all the access to the wonderful stuff that you have now. But yeah, totally embarrassing. It was horrible. So yeah, it was kind of crazy. But yeah, so that was my first experience with nursing theory. It's interesting to read through some of the nursing theorists, even looking at like how they developed their theories and some of the experiences that they've had. But I love reading people like about that. I don't like doing research, not gonna lie. Research is not my favorite thing. So we will jump into chapter 18. So chapter 18 is going to talk about, you know, where you can work and, how do you find the job that you're going to love or the job that you want to be in. With that being said, I'm going to tell you nursing is huge. There are so many opportunities out there for nurses. So even if you don't get your dream job right out of nursing school, keep trying. Sometimes getting just a little bit of a little bit of experience will help you to really get into the job that you love. Um, so nursing, again, it's totally different world. There's so many things that you can do. So just as some of the areas that you can work in, of course, long-term care facilities. And in long-term care facilities, you can be a charge nurse, you can be a nursing supervisor. I've seen LPNs as assistant director of nurses with assisted living facilities, depending on where you are and what state you live in. I've seen LPNs as director of nurses in assisted living facilities, independent living facilities, school nursing. School nursing, the requirements vary. Some require RNs, some will have LPNs. It depends just on your area. Home health nursing. Anybody want to do home health nursing? No, I'm not either. I don't want to go into people's homes. I don't know. Like, I just don't want to like show up at somebody's house. I don't know. Mental health nursing, military services. So you can join the military or even work for like the military hospitals. The VA is another big one. Hospital nursing. Again, variety of different opportunities within the hospital setting. Outpatient clinics, doctor's offices, urgent care centers, chiropractic offices, talked about the VA, hospice and palliative care, private duty nursing, health insurance, travel nursing, coroner's office, pharmaceutical sales. You can do travel nursing. So just as a like, so when I got my LPN, I started off in long-term care. Loved it. That's why I don't know. I love long-term care. I was one of those nursing students. I was like, I'm never gonna work in a nursing home, never gonna work in a nursing home. And right as I was graduating with my LPN, they had just transitioned LPNs out of the hospitals. Okay, so there were no hospital opportunities as an LPN. So I guess I worked in long-term care, but fell in love with long-term care. When I decided to go back to get my RN is when I transitioned to peds. So I worked in a peds clinic because it was Monday through Friday. It was during the day, and then I could go to school at night and do my clinicals on the weekends, right? So different opportunity based on what my needs were. And then when I graduated, I finished my RN and my bachelor's. And it's when I started at the insurance company. So just different experiences. And then of course I went back into long-term care and then in education. Um, I will tell you one of the things that I've always wished I would have done, and I did not know that this opportunity was available, and it's still very hard to find availability, is with the coroner's office. I always thought that would be very interesting to like help with like autopsies, right? And do stuff like that. I don't know if I have the stomach for it, like, as I've never had the opportunity to do that.
Do you do
But I
that on
always
the
thought,
LPN level? Do you do that on the LPN level, or that is that only RN?
no, that's for LPNs as well. So, like I said, I always thought that would be like super interesting to do. Um, and like I said, I don't know if I have the stomach for it, but if that's like learning, especially if you like really like to learn about like the pathology of diseases, or even trying to find the reason for why things occur, that might be something that might interest you. When I was at LPN in long-term care, one of the doctors that would come to the facility, he was actually um, a part-time medical examiner. Um, and he at one point had said that if we wanted to, like, we could go and watch an autopsy. And I never ended up following through with that. I think I was more afraid than anything else to actually go and do it. Um, but yeah. I think that would be really cool. If anybody is interested in that, you can look in to see if those opportunities are available, in your area. So, like I said, I thought that would be pretty cool. I don't know if anybody else would like it to be, would consider it pretty cool, but some of the helpful personal attributes, desirable qualities, being empathetic, of course, showing genuine concern, um, emotional stability, especially in stressful situations, right? Able to keep it together, under, stress, um, good observational skills, good critical thinking skills, decision-making skills, comfort level and skills within the scope of practice. And so one thing that I will tell you about your skills, you're going to perfect your skills based on the area that you are working. Okay, so for example, when I first started in nursing, we did everything for our clients. We started IVs, we drew blood, we did our trach care, we had a few trachs, we had, Foleys and peg tubes, right? We did all of that. And then as, nursing and things started to grow, get, I don't know, even know the word for it. A lot of this stuff is outsourced now, like your labs, somebody comes in and draws your labs for you. Even now, like here in Texas, if you have somebody that needs an IV, you call somebody and they'll come and search your IVs for you. I think it's just really interesting dynamic. Um, I remember when I first started nursing, in order to have somebody that needed a PICC line placed, they had to get sent out to the hospital. It was a whole big thing, right? You prep them just like they were going to surgery. Now, what do? They have somebody that comes and can put a PICC line in right at the bedside, right? Do an X-ray and ultrasound to verify placement, and it's good to go. So things that are different, but your skills are going to be perfected according to your area of practice. So keep that in mind. You may have to, keep up with your other skills, to make sure that you don't lose those. Um, Other things, you're able to follow physician orders under the supervision of an RN. Now, depending on where you work, your supervisor may not be an RN. You may have um, a doctor or a nurse practitioner that is your direct supervisor. You're assertive, you're a client advocate, and you maintain confidentiality as well as have a healthy way of relieving stress. Nursing is stressful. You have not heard that before. I'm here to tell you nursing is stressful. If you do not have positive coping mechanisms or ways that you relieve stress, start thinking of some now, whether it's taking a walk, reading a book, listening to music, going to get a massage, um, talking to a friend, whatever it is. Try to find a healthy way to relieve stress, so that it doesn't build up. Home health. So let's talk about home health. And I know a lot of people, some people love home health, other people are like, no, don't want to work in home health. Um, Home health has obviously some really good advantages, right? Especially when look at aging in place, or even, patients that are being discharged from the hospital and still need a little bit of extra care, or even some that are being discharged from your skilled care facilities, that no longer meet the need or meet the requirements for an inpatient stay, but still need like your PT or OT, or even nursing once they leave the facility. Um, and then again, as that baby boomer generation starts to get older and starting to need care, there's going to be a huge increase. And there's already a ton of needs in your home health, for anybody that is interested in home health. Um, Flexibility is probably one of the biggest things. I know a couple nurses that do like home health during the day, and then work overnights. And some of the stories they like, they have like a couple of different clients they have to see, and they're like from one side of town to the next side of town, and they only have a little bit of time to get there. But flexibility is, of course, and you're in somebody's home, so you don't have the resources that you would have whether you were in like you would have in a hospital or another facility. So again, that's where your critical thinking skills are really going to come in, right? How are you going to improvise when you don't have the specific equipment that you need? You also, the client's needs are going to change. Have to have good communication skills. Again, working in a client's home, you have to be able to express yourself clearly, tactfully. You also, may have to talk to them on, you have to touch your clients on their level in terms that they'll understand. You need to have self-confidence. Any insecurity or uncertainty is going to be picked up by other people, right? And so if they lose confidence in you as their nurse, right, then that is going to have, a negative consequence. And so making sure that you know your skills, that you can perform them effectively and efficiently. Um, you know, if you don't know how to do something, of course, you never say that in front of your clients, right? You go outside, you call your supervisor, ask for assistance, but you never want to let your client know that you don't know how to do something. Um, Being sensitive to physical and emotional changes. So, when you go in and you're doing your assessment, right, you're going to have to, not just look at their client, but you're going to have to look at the environment that the client is. So you want to make sure that it is safe, both for you as well for the client. If they start to become agitated, aggressive, things like that. Ability to deal with emergencies. Again, you're not going to have the same resources in somebody's home that you would have in a facility. So being able to stay calm, being able to follow your agency's protocol when emergency does occur, right? Do you need to call 911, right? Whatever the option is. And being non-judgmental. And this is probably one, that you really have to consider. You're in somebody's home, and not everybody keeps their homes clean and neat and organized. Um, and so you may go into homes that, may be a little bit messier. They may be hoarders, right? There may be a variety of different things. It's not our job to judge our clients, right? So we want to make sure that we're being non-judgmental. May not be the cleanest homes, but I will say the only thing is that you do have to maintain a safe environment for your client. So you may have to recommend some decluttering, right? Moving some furniture out of the way, removing the throw rugs, right? Making sure that it's safe for your clients.
Do you feel like
Um,
with home care we lose our skills? Because your patient ratio is not as high.
Yeah, you're definitely your patient ratio is not as high with home health than it would be. And there's even different types of home health nursing too. Like you have like the home health nursing where you'll go in and maybe, give medications or do a dressing change or something like that. But you also have like private duty home health, where you're there for like a full 8-hour shift or a full 12-hour shift, and you're providing all the care for that client. So depending on what their needs are. So, if they're like a tube feeder or they have wound care, they're on some sort of oxygen, whether it's a trach, whether it's a vent, those kinds of things. So, toileting, assisting them, um, turning and repositioning, right? You're gonna do all the care for that client. So it really just depends. Um, on what the needs of the client and what type of position that you have. I see a lot of like ads for private duty nursing through a lot of agencies. A lot of them are peds patients that and I've seen when I worked yeah, because some of the nurses even go to school with the kids. Like they'll spend the whole day with the kids. They'll go to school with them, take care of them while they're at school, get them home. So it's just interesting. There's, different opportunities that are available. Um, your interpersonal style. So the four basic personality types. Um, so we have the analytical type. The analytical type is highly detail oriented, can make difficult decisions without all the facts, is perceptive, also tends to be more pessimistic. The driver type tends to be blunt, objective focused. It's a hard worker, makes quick decisions, is independent, is considered one of those can-do people. Um, they also tend to be assertive, distrusting, impatient, high energy. They're motivated by external recognition, right? Like, hey, you're doing a great job. Like they want other people to recognize them. The amiable type likes to be liked, is easygoing. It's not a big risk taker. They like to blend in. They're sensitive. They have difficulty making firm decisions. They can be very quiet and soft spoken. And then we have the expressive type. Those are and everybody knows one of these, the natural salesperson and storyteller. They're good motivators, but they also tend to exaggerate, leave out facts and details. They're relationship oriented. Um, so being able to recognize the different personality traits it is helpful, whether it's with your classmates, your coworkers, or even your clients. It kind of helps you to how to, what's the word I'm looking for, to relate to their clients. So, for example, if we can recognize what type of their recognize their interpersonal style, how we address them is going to be a little bit different. So analytical type, tell me about yourself. You want to speak to the point. The driver type, what is how's your going? How is it, how's your day going? What is something you enjoy about nursing? You want to speak deliberately, you want to hit the highlights. Especially if you have something like you're giving, your turn or what is it? Shift or end of shift report, right? The driver type, basically just give them the highlights. Everybody's got a pulse and breathing, right? They just want to know what's going on. The amiable type, right? They want the small talk. Hey, how are you doing? How's your day been? Um, and then you'll get the information that you need. And the expressive type, they may start off with small talk, just to try to gain some trust. um but yeah, so everybody I'm sure has met somebody that falls into one of these four categories. um Anybody, can anybody has, or what's the word I'm looking for? Even see where you would fit, what's your personality type or what's your interpersonal style, right? Are you more analytical? Are you more driver, more amiable, more expressive? It's interesting because generally speaking, I'm more amiable. But when I go to work, just give me what I need to know so I can start my shift and get my stuff done. It really just kind of depends on where I am, and what I'm doing. Potential references. So getting ready to graduate from nursing school, you're looking to get a nice new job in nursing. And so think of people that you have worked with. And this can be your instructors. It could be even nurses that you've worked with in clinical, or if you're doing like your preceptorship, right? Your preceptor. But think about those, that have seen you work, and that might be willing to provide you with a reference. Um, so again, instructors, managers, supervisors, RNs, even some LPNs that you may have worked with. Um, you always want to get permission before using somebody as a reference. Okay. Um, and will tell you, don't always assume that they are going to give you a positive reference. Okay. So when you ask, okay, you want to say, can I use you as a positive reference? Um, if they say yes, make sure you got their information, their name, their title, their address or email address or phone number, that kind of thing, so that you can use them as a reference. But I will please make sure you ask them if you can use them as a positive reference. Um,
I never
and
heard
then
somebody say a positive reference. Usually, like, if you say reference, I'm not going to ask you for a bad reference.
correct. The reason why I say that, um, is because there have been times where you may think that you have a positive relationship with somebody, and it turns out that it is not positive on their end, and the references that have been given have been negative versus positive. Does that make sense? So really knowing who you're asking to provide a reference for you is super important, and really having their permission. And that's why you always ask. Um, if you can use them as a reference, just don't use somebody and not let them know. You can also ask for reference letters. So, you know, it's one thing to use somebody as a reference, providing their information and asking, and they'll send like a little questionnaire, right, as far as the reference goes. But you can also ask for letters of recommendation. It's always good to get letters of recommendation if it is possible. Some people would really like to write letters, others do not. So it's not always a guarantee. But if you can get a letter, that's always good to keep in your portfolio. So just we think about that. Start now, as you're getting ready. Networking. So networking is really good. It can help you find new jobs. It can help you, maybe get better pay, um, promotion faster, even promotes greater job satisfaction. And there's a variety of different opportunities out there. So things like placement personnel, they're good sources for job opportunities. So your career services advisor at one campus, they may have a list of open positions within the area that they can help you apply for. There's also like the what is it? Was that workforce centers? I'm trying to think of what else. And of course, you can always do things like Indeed, is another one, which would, well, that doesn't fall under placement personnel, never mind. But like, employment centers, I'm trying to think of where else it would be. Uh, family and friends. So ask them for job leads, names of contacts, and then follow up with them. So, like, maybe you have family that's already working in healthcare, somewhere that you want to work, or friends that are already working in healthcare. You can ask them about potential opportunities. Um, Social media sites, That's like your LinkedIn. I don't know if anybody has a LinkedIn account, but it is a professional social media site that can help you find mentors. It can help you find hiring managers, recruiters. There's lots of different information on LinkedIn that you can kind of connect. There is a job board on LinkedIn as well. Indeed is another one. So Indeed, you can search any state, any area, to try to look for a position. A lot of places, will advertise on Indeed. What else? I don't use Twitter. I don't know if anybody else uses Twitter. Facebook, those are some other social media sites that, be able to connect, for, other positions. What else? Career Builder, Glassdoor. Trying to think. I know there's more out there. You can go to, oh, it just slipped out of my head. Um, USA Jobs is another one if you're looking at, if you want to work like in a government position with like the VA, or even the military hospitals. I don't know what your area is, but USA Jobs is another one. Um, they obviously are just going to post jobs that on military facilities, va.gov. They will post on USA Jobs as well. The VA also may have its own postings, so you can look both. Anybody in Virginia? I don't remember. Nobody. No. I was gonna say I was reading in the area that I lived in Virginia. They built a new VA center, and it's been open. I think they said it's been open for like a year and they have like 300 vacancies. So they haven't been able to fill all the jobs in that area. And I just thought was like, that was really interesting. Um, so it's usually really good pay, a lot of benefits to the working for the VA. I don't work for the VA. It's not a job, it's not a like a promotion, but I have had a lot of former students that worked for the VA, a lot of friends that worked for the VA. They offered opportunities for tuition reimbursement, going to school. Another thing too, like if you're living in one area and you're like, hey, I want to move, and there's like another VA hospital in that area, if there's open positions, you have the potential for transferring within the VA system. So it is something to think about. Same thing with the military, like some of the military hospitals and clinics as well. So when you're networking, um, be positive with everyone you meet. And when you go and it's towards the end of your nursing school career for this program. But when you're out on those units with those clinical, with your clinical groups, your clinical instructor, working with other nurses, right? Always be positive. I would say those are potential hiring sites for you. The more positive you are doing, kind of going out of your way to make sure that you're doing everything you can. Managers and hiring managers are watching students, looking for potential new hires. So you always want to have the positive affect when you meet somebody. Build relationships with key people where you work. Making sure that you know who your managers are, that you're building relationships. Seek the input of your supervisor and other experienced nurses on how to build your career. Ask them to be your mentor. Um, be careful with who your mentor is. I'm just going to say that. Be willing to lend a hand without being asked to mentor others. This is huge. I cannot tell you how huge this is. Um, Nursing is a team sport. It's not an individual sport. Okay. You can't do it all yourself. Nobody can do it all themselves. If you see a coworker is struggling and you're not doing anything, go offer assistance. I'm that way even with my CNAs. if I'm not doing anything, if I don't have anything pressing that I need to do at the time, and there's call bells going off and they're running around crazy, I'm running around crazy with them. All right. I'm gonna go, change, reposition. I'm gonna get somebody up out of bed. I'm gonna take someone to the toilet. I'm gonna feed somebody. I'm gonna do whatever it is that I need to do to help them out. Always be willing to lend a hand. Ask about committees you might be able to participate in too. Participating in committees also will help you network within your organization, meet people from other units, and then join professional and community organizations. This is a really good way too to help you network and even meet people from other areas. Now, don't go out and join a whole bunch of professional organizations. It can be a little expensive. Um, but just really pay attention to some of the ones that you really would like to join. The resumes and the um application process, your resume. So this is where I always suggest that you get in touch with your career services, and have them assist you in preparing your resume. You put all your information in there. Um, Cover letters. There's a sample cover letter, I think, in your textbook. The cover letter is just a letter basically, it's directed towards the job that you are applying to. You're going to, as a nursing student and a new grad, since you don't have any nursing experience, you're going to highlight your academic and your clinical accomplishments, so things that you've done in school as well as in clinical. Um, and then answers to applicant questions. Don't falsify information. So I have seen this too. And please don't ever do it. For example, if they ask if you've ever been charged with a felony and you have and you answer no, you're going to be a nurse. They're going to do a background check. So it is always better to be upfront with all information. Um, don't lie. That's just you'll definitely won't get the job with that point. Your basic resume. And I don't know if anybody has written a resume yet, has a resume, but here's some basic resume facts. Okay. 2-page maximum. Okay. 1 page is preferred. You want to try to get all the pertinent information on 1 page. Try not to get it past 2. Use quality paper, white or off-white. You don't want any hot pink, hot, green, purples. You don't want any designs or textures on your resume. Just plain resume. Use the proper font. So Arial 2 Times New Roman 10 or 14 font is fine. Making sure you can use underlying. Yeah, I mean, you don't want to use, sorry, don't want to underline, you don't want to italic or anything like that. You can bold. Like on my resume, like I bold my job, like the jobs that I've had, I'll bold those with the times and the days or the times or the years or whatever. Just so that they can see a break. But you don't need to put anything else in there. Make sure you use spell check. Spell check and grammar check is very important. And make sure you proofread it. You have somebody else proofread it so that you can, make sure that you don't have any spelling or grammatical errors. If you don't have a computer, type it up on your computer. You can always have an electronic version to save. And then have a couple printed out so that when you go to your interview, you bring a copy of your resume. You shouldn't fax your resume. I don't think anybody really faxes anymore. It should have balanced space. You don't want to fill the whole page up, okay? You want to have nice borders. And emphasize your strengths. Especially for some who don't have a whole lot of their like job experience up to this point. You really want to highlight what your strengths are so that they'll see that. Um, all right, let's go ahead and take a break. Be back at 5. All right. I'm gonna finish up this chapter. All right. So there are some illegal questions. Um, this sounds kind of crazy. Um, and so how do I explain? If you choose to answer legal questions, just be very careful in how you answer them. So, have you been hospitalized within the past 5 years? Okay, so you don't have to answer the question, but should you choose to answer the question, you can say you don't have any health issues that would interfere with you fulfilling your described position. Have you ever been on workers' compensation? So you can answer NA, or you can just say I'm able to perform all of the described job duties. This one is big. And do you have a criminal record? This is where I was saying don't lie. Be honest and factual. You've got a speeding ticket, but you've not been convicted of any misdemeanors or felonies. Or, if you have a misdemeanor or a felony on your record, you can say you've paid for the errors and judgments, you've taken classes, whatever you've done. Um, you want to be honest and factual. So like I said, you're going to be a nurse. They are going to do a background check. So if you lie and say that you've never had a felony or a misdemeanor and it does come back on your background check, then of course that's going to be an area of concern, right? That you've lied on your application. So be honest, be factual with with that information. Preparing for the interview. So if you've not ever had a job, or even if you want to get some help with your interview skills, your career services person is helpful for there. Um, but a couple of things that, when you go for your interview, bring your resume, bring your license if you've already passed your NCLEX, your CPR card, if you've got your, hepatitis B, your Tdap, your, last PPD, whatever, you want to bring those with you as well. Any letter of recommendations, you want to bring all that. Always do some research on the organization that you were interviewing with. I've read a lot of different articles, and one of the things that says is, if you don't have any questions about, the organization or have any questions whatsoever, it's kind of not a huge red flag, but have something, ask some questions. So you can ask, what's the scheduling like? Is it 8-hour shifts? Is it 12-hour shifts? How big is the facility? What's the normal, nurse to client ratio? What type of, EMR system do they use? How long is orientation? Is there any mentoring processes for new hires? You can even ask like, what is the turnover rate of staff? And if it's a new position, why was the position added? If it was an existing position, you can ask, why did the, person leave? Just kind of things like that. Some of the interview questions that they may ask you is, tell me about yourself. Everybody hates that question. Okay. Um, and I always ask, what do you want to know? Do you want to know personal stuff, or do you want to know, professional? Do you like, where are you from kind of things, or, what's your, professional experience? Have you done this type of work before? So as new grads, you may, just, within your clinical experiences. Why do you want to work here? That's always a big thing. So that's why I say do some research into the organization that you're going to interview with. Look at their mission statement. How does that align with what you are looking for? They may ask you what your motivators are. Why did you leave your last job? Ask about they may ask you about your former employers. I will tell you, never talk bad about a former employer, even if it was a horrible experience. You can just, tell them, what are some of the things that liked about your position? What did you learn? What were your experiences like? Um, what else? Why should I hire you? That's always a good thing. Why do you stand out over other candidates? When can you start? And then of course some of the other ones are like, what are, three strengths and three weaknesses? Um, what are your long-term goals? They can also ask you about, if childcare would be issue. Um, I'm trying to think, they'll ask, what is your desired salary? So you can Google, I think there's, and in your book too, there are some sample interview questions in there as well. Difficult questions or example questions. You can use the STAR method that may be effective to help you kind of just organize your thoughts when you're answering your questions. Um, Make a lasting impression. So, the it's been said that the initial impression is made within the first 30 seconds, right? So when you go in there, you want to make sure you have good hygiene, that your hair is in a moderate style, um, your makeup is not excessive, it's eyewear. I would recommend that you don't have your fake eyelashes, that your nails are short, clean. You don't have, the big, long, acrylics on. Stand tall, right? Show courtesy. Um, you also don't want to go in if you smoke, you don't want to go in smelling like cigarette smoke. You don't want to use a whole lot of perfume or body sprays because again, you don't know if somebody is going to be allergic to that. And then, make sure you brush your teeth. Um, what else? Clothing, generally speaking, you can ask, but you want to wear more conservative clothing. If for some reason, you can ask if you can wear scrubs to an interview, but I always suggest just dressing in like a visual business casual. Um, when you go in for your interview. And then follow up after the interview is really, really important. Okay. So after the interview, you want to follow up. And so you want to write a handwritten or email thank you letter to the interviewer the same day that you were interviewed. So you get home from the interview, you want to either sit down and write a thank you letter and mail it to them, or you want to send them an email. You want to do it while it's fresh in your mind, while you're fresh in their mind. Um, and, within your email letter, you can just say, thank you for taking the time to meet with me today to discuss the open position. Um, you thought about, the job duties, whatever you feel that your experience and your education would be a good match for the job and that you are interested in the position still. And then you can also say, I'll contact you on a specific date to see whether or not you've made a decision or, what the next process is. Is there a second interview? Like, what is the rest of the process? But you always, like I said, you want to make sure that you send that follow up after that same day. Same thing with resigning. So if you've not, if you're leaving a job, you're going to another position, you always want to resign appropriately. All right. Most organizations have at least a 2-week resignation. So Some places may be more, so you want to make sure that you check your policy and your procedure, your policy at your current employer before you leave. And you always want to leave, never burn your bridges, okay? And no, there's a lot of nurses out there, there's a lot of hospitals, a lot of facilities, but nursing is a very small world, okay? Um, so you always, like I said, you always want to, be respectful. Thank you for allowing me the opportunity. It's been, I've learned so much, it's been a great experience. But my effective date would, of termination or of resignation would be such and such a date. Again, you just want to you can be very straightforward, but you don't want to be negative with your resignation. Just give them the information that they need. Transitioning to practice. Um, Depending on where you go, is going to determine. So the NCSBN, which is the National Council for License or the National Council of State Boards of Nursing, they developed this transition to practice model. And it's similar to a residency. Um, and so they will usually a trained nurse or preceptor is there to assist the new grad apply their theory to practice, develop their clinical reasoning, improve safety, decrease practice errors in the client care of clients. And there's 5 online modules. So communication and teamwork, client-centered care, evidence-based practice, quality improvement, and informatics. Not every organization uses the transition to practice model. So you may see something a little bit different in your organization that you go to work at. Some do have residencies, or more detailed orientation schedule, and usually are assigned to a preceptor during that time. It really just depends on where you're working as to what the orientation process will look at. Long-term care, there's usually a pretty significant difference in the orientation models. It's generally not as extensive as a hospital orientation is. But I will tell you, the average is usually like 30 days of orientation. However, if you need more orientation, you need to, be assertive, stick up for yourself, and request more additional days. You don't want to just go in and think you can do it, and find yourself stuck. So depending on where you work is going to determine, right, your orientation process. We look at professional organizations. So this helps with career development. It's an opportunity to meet leaders, learn about current issues that affect your career. There's also educational opportunities, and you can even serve on committees should you choose to. So the NLN, which is the National League of Nursing, is open to all level of nurses. It's focused on meeting needs of the nursing educator, helping to advance, of course, the health of the nation. It helps to set standards that advance excellence and innovation in nursing education. Your American Nurses Association, it only represents RNs, but some state affiliates of the ANA allow LPNs to join, so you have to look. There's NAPNES, which is the National Association for Practical Nurse Education and Service. This has open membership to LPNs, LVNs, RNs, students, schools as well. And so there's a variety of resources that are there for you as well. So there's journals that are devoted specifically to the LPNs. There's information, you can find information about certifications, regulation updates, CEUs. And then you have the National Association of Licensed Practical Nurses. That is the policy making body for LPNs. And they also have established the nursing practice standards for LPNs. So that is something. There's also with the National Association of Licensed Practical Nurses, that's where you'll also find information about the IV therapy certification, the long-term care certification as well. And then continuing education. So once you get your license, make sure that you look at your state board of nursing to see what continuing education requirements are going to need in order for you to maintain your license. All right. So be very careful with that. Each state is different as far as the requirements. And these are yearly continuing education hours, not, oh my gosh, I have to renew my license tomorrow. Let me do all these hours. Like you have to do them every year. So make sure that you look and see what your state requirements are. If you have a certification, so if you decide to go get your IV certification or your long-term care certification, in order to renew those, you have to do continuing education in those specific areas as well. So always be mindful of that. But when you are working, you will have in-service trainings that will need to be due. There's a variety of different resources for those. Like I know a lot of places, like a lot of long-term care facilities will use things like Relias, or Sniff Clinic. In hospitals, they may have a different system that they may use. And those are usually required by your organization that you complete those. There may be workshops available depending on, where you're working. There's also internet resources like podcasts. Now, podcasts aren't going to give you CE credits, but it will it is a good place for you to learn about new things, keep up to date. Um, talked about those, talked about those. Um, and then talking about the registered nurse career pathway. So, as an LPN, you do have a wide variety of options that are available to you. However, um, getting your RN is going to even open up more opportunities. So think about once you're done with your LPN, coming back and getting your RN. Salary differences are, in a lot of areas are very significant. Um, and if you are interested in moving forward and going back to get your RN, look at jobs that offer some sort of like tuition reimbursement or things like that, because they may help you to fund your RN education. The only, you may have to work for them for like, a certain amount of time, after you have, complete, if they're giving you money for school, then you may have to work with them, work for the organization for, a certain amount of time when you're done, which is usually a requirement. But it really just kind of depends on where you're working. I noticed now, and I've never, I haven't been really looking for a job, but I know that a lot of places now will help you with your student loan reimbursement. Have you seen that? So there are places, and don't quote me on where they are. Like I've seen them, where they will actually help you pay back your student loans. So that may be something when you're looking for somewhere to go to, to work, that you may find somewhere that may help you pay back your student loans. That's always good, right? Just thought, throw that out there. Um, so, all right. So who wants to go back and get their RN when they're done? Okay. Some of y'all, maybe some undecided as well. Um, so LPNs, there's some really great opportunities as LPNs out there. Some of them, when you look at getting, moving some of the opportunities, what's the word I'm looking for? Some of the opportunities do require you to have a little bit of experience to kind of move, but getting a good foundation is really good. So like my daughter, I just use her as an example. My youngest daughter is my oldest daughter is a RN, my youngest daughter is LPN. Um, and she started off in long-term care and then she worked in OBGYN, and she really enjoyed that. But then when she got pregnant with my grandson, she thought she could do it. She was all ready to put him in daycare, and then decided that while she was on maternity leave that she did not want to have to put him in daycare, that she wanted to stay home, stay home with him. But she had to still work. So she was able to find she is, I think it's called health coaching. And so she works from home so she can stay home with the kids. So and she does it online. So it's basically like calling up and following up with, patients that, have disease processes going on like hypertension and diabetes and whatever. And, making sure that they're following up their providers, that they, have their medications, that, and then of course, if they have any questions, any concerns, that kind of thing, then she's there to answer those as well. So it's just interesting. So, but again, always suggest getting a little bit of experience when you first start, so that not only can you get the skills and the critical thinking and the clinical reasoning part down, it gives you also some really good foundation skills so that as you decide what you want to do, if that's not what your dream job is, you can start to kind of branch out into other areas to see, and find your niche in nursing. Because like I said, there's just so much in nursing that you can do. And once you find it, you'll usually find that one place that you love and that you don't want to leave. Um, but yeah. All right. So we did chapter 13. We talked about nursing theory. We talked about chapter 18, finding your job, and some of, things that you can do to prepare for your interview, um, getting your resume. Has any of y'all talked to your career services advisor on campus? Yes. So like I said, they can be really helpful with getting your resume together, doing practice interviews. Some people get really nervous, especially when you have to talk about yourself. So, the more practice interviews you can do really can help to prepare you for the interview. Again, make sure you do research so that you have some questions to ask the interviewer when you go there to show that you really are interested in the organization. Trying to think of what else. Um, has anybody already found a job for when they graduate? Yes, some of you have. All right, cool. So that makes it a little bit easier. Anybody went to a clinical site and found a position? No. So we had, so I have a couple minutes. We had this one clinical site, one of the first schools that I worked for, when we would take the students, it was a long-term care facility, we did their foundations courses in the long-term care facility. And the administrator would always come and ask me, okay, when's the last day of their rotation? And so, I would tell them, he would have a schedule like of when we were going to be there. So like halfway through the term, he would throw them like a pizza party. And then at the end of the term, he would get them like a cake and some other stuff. Um, as a way to try to encourage them to come work for the company once they graduated. I did try to explain at one point. I was like, this is like their first nursing course. Like they don't graduate for like another, year. And he's like, okay, it's okay. He's like, they'll remember me if I keep doing this. I'm like, okay. So yeah, so the students enjoyed their clinical rotation, but some of them, most of them, didn't end up working for the organization, but some of them did. And it was a good organization to work for. But yeah, I always thought that was funny. Other places I've seen do that too. Especially if the students get really involved in the units that they are on. A lot of times, they'll have little things for the students and their last day of their rotation. But like I said, when you're out there, and I know you only have a few weeks left, they are really looking at you as potential employees. So always going out there and doing your best, giving it your all, showing that you're a team player, that you're willing to help and assist. Those are going to cause you to stand out, and have potential for a job offer in the long run. So just something to think about. Um, but all right. So next, again, this week, we're going to be turning off the homework grades. So you'll just be able to see your KGA. And so week 7, there's your discussion on delegation and leadership. And then week 8, we have your NCLEX questions and your NCSBN position paper. So there's no quiz next week. Your next quiz is going to be in week 9. So if you don't have any questions, I hope you all have a great week.
Is it okay for
See
us to
you
turn
Friday.
in the paper now?
Yes, for the late date is, let me just double check
No,
it.
I'm talking about the next paper, the second paper.
Oh yeah.
Okay.
Yep.
You'll give us feedback on it?
Mhm.